And this is our advisor. And this our member group. And this budget. The first is signalement. The calf named creatine species was tolerant between multi-patient and age 4 months, sex male and body weight 40 kilograms. The next is history checking. At 10 years of age, the owner complained that she had multifocal sclerosis and clinical signs was suspected fever, depression, and decreased appetite. Getting treated by amoxicillin and gentamicin for sucralose and diclofenac sodium for 3 times, and budesonide with gentian berry and valproate powder. Next 4 months, Getting had the same clinical signs, so the owner treated Getting with diclofenac sodium and budesonide with gentian berry and valproate powder. And 10 days later, we visit the farm. From history taking, Getting had decreased appetite, but water intake was normal. Defecation was normal and urination was not observed. Getting had differed with oxydectin once a month by Pro-on, and owner feed him with chopped napier grass and commercial pellets. The next is physical examination. The calf was quite alert, responsive, because membrane were pale pink, CRT less than 2 seconds, hydration status 6 to 8%, and body temperature, heart rate, respiratory rate, heart sound, lung sound were normal, and lumen condition rate complete to cycle in 2 minutes. The picture shows multifocal skin nodule with necrotic tissue on the skin and mucous membrane. The picture shows specific lesion is necrotic skin nodule called cyphus with hoist.
The next topic is problem list. In this case, we can divide the problem into 2 groups, including specific and non-specific problem. Specific problem is multifocal skin nodule with necrotic tissue, and non-specific problem are lethargy and decreased appetite. For initial assessment about the multifocal skin nodule, we can assess it just like a lab. We can divide it into 2 types of process with non-neoplastic and neoplastic. The non-neoplastic we can divide into 2 types as well, the infection and non-infection. Infection including lumpy skin disease, pseudo-lumpy skin disease, cowpox, pseudo-cowpox, bovine papilla, somatic, dermatosclerosis, dermatophytosis, and dermatophytosis. For non-infection including inflammation, cyst, hematoma, and urticaria, and for neoplastic including papilloma, SCC, fibroma, and liposarcoma. For the initial plan, we collect the blood sample to do a complete blood count and pigmentation check. Moreover, we collect fecal sample to check endoparasitic infection. Laboratory finding, we found monocerosis neutrophilia, decreased MCV but only a few that are not significant, and phagocytosis and increased fibrinogen. And for fecal sample collection, we found anorexia infection.
The next is rural assessment about infection consists of lumpy skin disease, pseudo-lumpy skin disease, dermatophytosis, and dermatophytosis that cannot be ruled out because of the similar morphology, lesion, and location. However, cowpox and pseudo-cowpox can be ruled out because the location of lesions are at teeth and other, and the characteristic morphology of pseudo-cowpox are horseshoe or ring shape, and broad papular stomatitis lesions are usual, margin of lips or mucosal, and some at teeth. Dermatophytosis can be ruled out because lesions are scaling patches of hair loss with gray-white crust formation. Some can be thick cracks with separation and only present as superficial skin. But in this case, the lesions are present generalized all over the body, except the teeth and other, and the lesions are deep into the muscle. About non-infection part, since urticaria and hematoma can be ruled out since the morphology isn't like what contain have, and the neoplastic, we can rule out all of the causes that shown on the table because Rotting is a young age cow and the characteristic region of the disease is not similar to Rotting nodule. Next is differential diagnosis. Now we have 4 diseases which are lumpy skin disease, pseudo-lumpy skin disease, dermatophytosis, and demodicosis. Next is the treatment we use that day, which consists of 2 drugs. The first one is antibiotic safety offer. Thus 2.5 mg per kilo in total, 1.7 cc once a day, intramuscularly route for 5 days. And the second is anti-inflammatory drug, phenylbutazone. Thus 9.3 mg per kilo in total, 1.7 cc once a day, intramuscularly route for 3 days. Next is the further plan. Since we cannot rule out the disease we mentioned before, a further plan that can be done to diagnose lumpy skin disease and pseudo-lumpy skin disease is sampling from skin biopsy from skin nodule or scabs, from upper body part, blood, swab from nasal. Then do the molecular examination. Real-time PCR is the specific choice of the diagnosis method and it can distinguish 2 diseases. Moreover, cytology and bacterial culture can be done to rule out dermatophytosis, and demodicosis can be ruled out by skin scraping from active lesion. The next part is discussion. Lumpy skin disease is an emerging infectious disease in Southeast Asia in 2020. In 2020, the disease was found in Vietnam and Myanmar before reaching Laos and Thailand. The first outbreak of lumpy skin disease in Thailand was reported in March 2021. Lumpy skin disease is an acute to chronic, highly infectious and generalized skin disease of cattle and buffalo. It is caused by lumpy skin disease virus. The virus has been classified into family Poxviridae, genus Cabripox and strain Needling, which affect large ruminants, especially cattle and buffalo. For the transmission, lumpy skin disease is a vector-borne disease mainly transmitted by biting insects such as mosquito, fly, and ticks, and also direct contact with infected animal by skin lesion, saliva, secretion, milk, and semen. Indirect contact with contaminated fomites and vehicle, and the virus can be vertical transmission through intrauterine transmission, and it is assumed that the virus can be shed through vaginal secretion. The incubation period is 4 to 7 days and can up to 28 to 35 days. The mobility rates are often 5 to 40% and mortality rates are usually low, about less than 10%, and the disease is not zoonotic.
For clinical signs after the incubation period can be classified into 4 phases. Phase 1 or acute phase. Animals will have fever, increased nasal or ocular discharge, saliva secretion, and may found multinodular lesions around the skin and pus membrane. Phase 2. Animal will have multinodular lesions around the skin and the pus membrane, mostly on the head, neck, limbs, under genitalia and perineum. And found superficial lymph node enlargement 3 to 5 times of their normal. Sometimes the edema of limbs can be found. Phase 3. Multinodular lesions rupture into ulceration and become necrotic tissue. Animals will show pain and lack of movement. If there is secondary bacterial infection, the abscess of pus may also occur. And phase 4, after at least 1 month, there is complete healing of ulceration and also beginning of the skin and hyperpigmentation of the lesion. From the clinical signs and lesions, it was found that Vaccine was in phase 3 due to showing rupture nodules with isolation and necrotic tissue, and especially the specific skin lesions called fat. For diagnosis, the lumpy skin disease virus can be diagnosed in the laboratory. The samples can obtain from skin lesions such as full thickness biopsy and scab, blood, swab from nasal or saliva, and semen. It was found that samples from skin lesions were able to detect more viral load than blood and secretion. The methods for detecting virus include viral isolation, histopathology by immunohistochemistry, and PCR or real-time PCR, which is a specific method. And the method for detecting antibodies include ELISA, indirect fluorescent antibody test, and viral neutralization. For treatment, due to viral infection, there is no specific treatment, so supportive treatment is needed by giving antibiotics to prevent secondary bacterial infection. Topical drugs such as gentian violet or povidone iodine. Anti-inflammatory drugs to reduce inflammation, fever, and pain. And vitamin A, D3E or vitamin B complex to stimulate appetite, enhance the health of skin cells and the reproductive system. The next step will be how to control and prevent lumpy skin disease. First, disease must be closely monitored. New animals should be quarantined for 2 months. In addition, in high-risk areas, do not move animals to different areas. The infected animals should be isolated from the herd for treatment or medical. And for vector control can be done by spraying insecticides and protect animals from insects by using chemicals or insect net. And materials that are likely to be contaminated must be cleaned regularly by using disinfectants. However, the most effective method is immunization through vaccination. This is vaccine which has been used to control and prevent lumpy skin disease in Thailand. It is homologous live attenuated lumpy skin disease virus vaccine for niggling strain. After vaccination, the immunity is raised within 10 to 30 days. The vaccine is recommended for animals at any age by injection 1 ml subcutaneous route and should have a booster injection every year. So in this part, it will be farm disease control and prevention. Things that the farm manage to control and prevent the disease include disinfection, vector control, and vaccination. For vector control, farm use antiparasitic drugs to prevent ectoparasites. In calf, use moxidectin, and in adult cattle, use ivermectin. And also spray insecticides and use insect net. And for vaccination, farm started lumpy skin disease vaccination on the beginning of this year. The vaccine that the farm used is lumpy vaccine lumpy vaccine imported by Department of Livestock Development, which is live attenuated virus vaccine. And these are our references. Thank you for your attention, and if you have questions, please feel free to ask.